Tuberculosis explained, simply in 3 minutes. Hi everyone, let's take 3 minutes to talk about something that still affects millions of people around the world, tuberculosis, or TB. What is TB? Tuberculosis is a serious infection caused by a bacteria called Mycobacterium tuberculosis. It mainly affects the lungs, but it can also attack other parts of the body like the brain, kidneys, or spine. But here's the thing, TB is preventable and treatable. The problem is that many people don't recognize the symptoms early. How does it spread? TB spreads through the air, just like the flu. If someone with active TB in their lungs coughs, sneezes, or even talks, the bacteria can float in the air. If you breathe it in, you might get infected. But not everyone who breathes it in gets sick right away. 2 types of TB. Latent TB. You have the bacteria, but it's asleep. You don't feel sick, you're not contagious, but it can wake up later, especially if your immune system weakens. Active TB. The bacteria are awake and multiplying. You feel sick, and you can spread it to others. Symptoms of active TB. A cough that lasts more than 3 weeks. Coughing up blood, chest pain, fever, night sweats, unexplained weight loss, fatigue. If you have these symptoms, don't wait, see a doctor and get tested. How is TB diagnosed? Doctors can use a skin test, blood test, chest X-ray, or a test of the mucus from your lungs. Quick diagnosis equals quicker treatment equals better outcomes. Can TB be treated? Yes, 100%. TB is treated with antibiotics, usually for 6 to 9 months. It's very important to take the full course. If you stop too early, the bacteria can become resistant and much harder to treat. There's also drug-resistant TB, which happens when the bacteria don't respond to standard medications. That's why proper treatment and follow-up are crucial. Who's at risk? TB is more common in areas with overcrowded housing, poor ventilation, weak health systems. Also, people with weakened immune systems, like those with HIV, diabetes, or those on immune-suppressing meds, are at higher risk. Final thought. Tuberculosis may sound old school, but it's still here, and still dangerous. The good news? We can beat it with awareness, early detection, and proper treatment. So if you or someone you know is showing signs, don't ignore it. TB is treatable, but only if you act early.